The FDA is considering whether to allow the nation's first ever over-the-counter birth control pill. It's called Opill. Right now, it's only approved with a prescription. Elizabeth Cohen has more.
Caitlin Pace, a native New Yorker, moved to Hong Kong 3 years ago for a teaching job. She still remembers when she went to buy birth control pills there for the first time.
It was so easy. And I kind of just looked around and was like, did that just happen?
In Hong Kong, you can just walk into a drugstore and get birth control pills. They're right there on the shelf, just like aspirin or shampoo. Advisors to the FDA are meeting this week to consider whether this birth control pill, Opill, should be sold in the same way, right over the counter. It would be the first over-the-counter birth control pill in the U.S.
I think many people have been looking to have a birth control pill like this over the counter for a long time.
Dr. Kristen Brandy is a practicing OBGYN and a spokesperson for the American College of Obstetricians and Gynecologists, which, along with the American Medical Association, supports the pill going over the counter.
We have to give people all the tools that they can to protect themselves, protect their health. And this is one great option that I hope will be able to be pushed forward.
But in a briefing document filed last week, the FDA seemed less than enthusiastic about the idea. They say more women are overweight now, as are all Americans, than when Opill was first approved 50 years ago as a prescription drug, pointing out that 60% of people of reproductive age in the U.S. are overweight or obese. The degree to which efficacy of Opill is diminished in individuals who are overweight or obese remains unknown, the FDA scientists wrote. They also say that studies conducted by Opill's manufacturer indicate in a non-prescription setting, consumers may not correctly follow use directions. But Dr. Brandy says there's no reason to think Opill will be less effective in heavier women. And on their second concern,
because they're smart and they can read the back of a pill bottle, just like they do any other medication over the counter.
Perrigo, which makes the pill, says data from our 8-year development program show that consumers can use Opill safely and effectively as guided by the proposed labeling. Back in Hong Kong, Pace says her friends in the U.S. are jealous.
I think that if women could just walk into a CVS or a Walgreens and get what they need, I think it could really, really change their lives for the better, 100%.
Elizabeth Cohen, CNN, reporting.